Tylenol is not good. All right, I'll say it. It's not good. Don't take Tylenol. Don't take it. If you just can't, I mean, it's just fight like hell not to take it.
This was on Monday. The Trump administration said the use of Tylenol during pregnancy could be linked to autism, despite no evidence showing a direct cause and effect. Now, that led several medical and scientific groups to publicly reject the claim. KVUE has interviewed doctors and researchers about this. This morning, we asked a reproductive specialist from Aspire Fertility to weigh in. Dr. Deborah Ikhena-Abel is board certified in obstetrics and gynecology and reproductive endocrinology and infertility. You got the creds there, right there. Dr. Deborah, thanks for coming back to KVUE News Midday.
Of course, thank you for having me.
Absolutely. Okay, how strong is the research that shows an association between Tylenol and autism?
So the research is pretty weak. There is research, and like you said, it shows an association. These are from small studies that are usually done what we call retrospectively. So they go back and ask women, so what did you take in pregnancy? And then look and see if these women have a child with autism. And the studies that are being cited to support this decision are just not well designed. We do have other studies that have been done more rigorously that show that there really isn't that causal link or even as strong of an association, if any, as we thought was present previously.
So what are your patients telling you? What are you hearing?
So people are definitely concerned. Patients come to me because they see the announcement by the White House. There are lots of people, on social media making similar announcements. And also they see these studies that are poorly designed. And when you're not someone who is trained in understanding and analyzing research data, it's easy to get swayed and think that two studies have equal importance.
Right. So if pregnant women are afraid to take Tylenol now, what happens if they say let a fever persist?
So I think that's the most important question here. I think with every medicine, there are very few physicians who are not always weighing the risks and the benefits of every intervention. And so when you tell pregnant women not to take Tylenol in pregnancy, the question is, well, what are the alternatives and what are the risks associated or found to have a causal effect from the alternatives? So right now, if a woman has a fever and temperature and decides not to treat the fever, we know that fevers are associated with an increased risk of preterm delivery, miscarriage, stillbirth, and also neurodevelopmental disorders, which include autism and ADHD, and which is one of the confounding factors for the studies looking at Tylenol, where we're not always separating the people who had the fever from the treatment for the fever. So if you do a study looking at Tylenol in pregnancy and you're not controlling for fever in pregnancy, then you may mistakenly decide that the cause or the link is between Tylenol and ADHD versus between the fever that the Tylenol is being used to treat an ADHD.
Right, and right now, again, there's no direct evidence, for a cause and effect.
Exactly,
right?
exactly. It's just an association.
But for the women still scared and don't want to take a chance, what are some alternatives for these pregnant women?
So right now, we don't have a lot of good alternatives for pain control in pregnancy. So let's start with aspirin. A baby aspirin, 81 milligrams, that's fine to take in pregnancy. We use that sometimes to prevent preeclampsia, but it's not strong enough to treat pain in pregnancy. Now, higher doses of aspirin in pregnancy, which can treat pain, like 325, have been linked with a premature closure of what we call the PDA, or the patent ductus arteriosus. This is the hole in the heart that helps the baby have oxygenation while in the uterus, because the lungs are, of course, not breathing in utero. So if you take aspirin in pregnancy and have a closure of the PDA, that is a more significant issue because that could lead to something like stillbirth down the road. So you want to be cautious and not take that in pregnancy. The other alternative for pain medicine would be Motrin or ibuprofen, which also has been linked with premature closure of the PDA and also decreases blood flow to the kidneys in pregnancy, which can lead to decreased fluid around the baby in pregnancy. And then if you go past those options, we're thinking of opioids, which we all know the dangers of those.
Right.
Now, short-term exposure in pregnancy to opioids is fine if you need surgery or something along those lines, but we definitely want to avoid prolonged exposure in pregnancy. So Tylenol is currently the safest option we have for the treatment of pain in pregnancy, and well-designed studies which have controlled for the genetic associations with autism and ADHD have not found a link between Tylenol use and ADHD and autism. So for example, there's this really well-designed Swedish study with about 2.5 million participants, which is the Swedish National Registry of all children born in Sweden since 1995. And they said when they first looked at just Tylenol use, they found like a 0.02 like a very mild increase. But when they accounted for siblings, they found that there was actually no association. So what they had seen previously was actually more confounded by the fact that people who have a family history of autism are more likely to have kids with autism versus, which we know is very clearly the case, versus Tylenol, it's being the actual cause for the finding that was observed.
All this underscores the importance of, if you have a question, please talk to your medical provider,
Exactly.
right? You can explain it in depth instead of just listening to 30 seconds on TV. Dr. Debo, thank you so much for your time.
Of course, thank you so
and
much
your
for
knowledge,
having me.
of course.
Of course, thank you.